You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs for the treatment of gum disease. With us, we have an expert on the topic, Dr. Weir. Dr. Weir, welcome to the program.
Thanks for having me, Randy.
Now, we've had you on the program before talking about
dental implants.
Dental implants, no more dentures. A big part of your practice is laser dentistry, wiping out gum disease, right?
Absolutely.
Now, for people that don't know you, tell me a little bit about your practice. Who's your typical patient? Because I guess you work there with a partner, and you guys do just about everything under one roof.
Yeah, I've been in Charleston practicing for over almost 25 years now. My partner, Dr. James Thomas, has been with me about 10 years. And we're a comprehensive general dental office. We treat everything. We treat young children, we treat adults well into retirement, dentures, crowns, fillings. We offer CEREC, where we can do crowns in a day. Two of the exciting areas of our practice is the use of dental implants and the use of laser to treat periodontal disease. That's an area that I really enjoy working in.
Okay, so with gum disease, I guess this is the number one reason why you lose your teeth. What are the symptoms? I mean, define it a little bit for us.
Well, one of the problems with gum disease is there's not a lot of early symptoms for a patient. Typically, the disease will be beginning, and the first time they're aware they have a problem, they'll start to get bleeding gums. And for some reason, patients are willing...
Like while they're flossing?
While they're flossing, okay. While they're brushing. And for some reason, they seem willing to accept that. And any other part of their body bleeds when they wash it, they'd be going to the doctor. But
is it okay to have a little bit of blood when you...
No, it's not. It's not. Is it okay for your hand to bleed for no reason? I mean, your body's not supposed to bleed. Right. And if it is, that's a sign of disease. There's something going on there that's not right. And then it's caused by bacteria getting under the gums, setting up inflammation and an infection, which ultimately leads to bone loss. But prior to that, they're going to get bleeding gums, and they're going to start to get bad breath. That's probably one of the early things that we'll start to see. And patients seem to be willing to ignore that in the early phases, which makes it more difficult to treat them as the disease progresses.
So what are the symptoms for gum disease?
Well, after you've progressed through the bleeding, the gums, and the bad breath, you'll start to get loosening of the teeth. You'll start to have pain, just general achiness, because your teeth are starting to move.
Why are they moving?
Because you're losing the bone around them. The bone around the teeth is just dissolving away because of the bacterial infection around them.
So it's an infection under the gum line?
It's an infection under the gum. And as a result of the infection is the body is losing bone around the teeth.
And then the teeth ultimately fall out?
Ultimately fall out. Yep.
Okay. What about puffy red gums?
Puffy red gums, absolutely. And that's where the bleeding comes from. As the first part of the disease is your body trying to fight the bacterial infection, so the blood supply increases to that area of the mouth to fight the disease, which gives you puffy, red, purple, bleedy gums. And unfortunately, when the blood supply comes in, so does the nerves. So when they do go to the dentist and they get their teeth cleaned, it's very uncomfortable because they've got this disease. So they go, oh, it hurts when I get my teeth cleaned. They don't accept that it hurts because I have disease. And often they won't come back. They don't understand that there's a disease process going on.
So most of the people that have dentures, they had this periodontal disease or gum disease?
Absolutely.
Is it the same thing, gum disease and periodontal disease?
Yes. Periodontal disease is defined by loss of bone around teeth. Gum disease starts as the puffy, swollen gums we're discussing. That can be reversed. Simply getting a good thorough cleaning from your hygienist, getting some education on how to better take care of your teeth. If you catch it early, that's the extent of treatment. It's when you get into periodontal disease where bone loss is beginning to occur. Now that no matter how hard you try, you develop pockets around your teeth where the height of the gum to the height of the bone gets deeper than the ability of floss and toothbrush to reach. So even if you do begin...
So the gums kind of move away from the teeth?
Yep, they move away and the bone moves away. And the problem is you can only clean part of that. No matter how good a job you start doing on your teeth cleaning, you can't get to that bacteria at the bottom because it's too far down. That's when we need to intervene, and that's where the laser...
So the good news is, I guess you're able to go in with a laser, kill this infection.
Absolutely.
Okay, so how is it normally done? Because I said it's a new breakthrough,
right.
Okay? How is it normally done? How is it normally taken care of?
Well,
how do you do it?
The way I was trained and the way I treated patients for years and the way most periodontal treatment has been done for years is to cut the gums and actually peel them away from the bone around the teeth. And it's just like it sounds. We're just literally peeling the gums away, cleaning out the bacteria, absolutely, and trimming gum away and putting it back lower on the tooth to make that pocket easier to clean. And it's effective. It reduces the pocket, it can be maintained, and the gums can be healthier. But it's a painful process.
So this is a bacterial infection.
Absolutely. The bacteria
So
need
you
to
were
be
cutting
removed.
out, so routinely every day today, they cut out the infection.
Absolutely.
Is that right?
Yes, but they're cutting out the tissue, they're cutting out healthy tissue, they're cutting out infected tissue, and they're cleaning the bacteria out. You have to get rid of the bacteria, and you have to the key to periodontal treatment is getting the gums healthy and be able to maintain them healthy, because periodontal disease is a lifetime disease. If you can't just treat it once. You have to treat it and you have to maintain it.
So that's one option. What's the other option?
We use the laser. And it is a surgery, but it's a much, much less invasive surgery. We're able to use a laser to remove just the diseased tissue. That red, puffy, inflamed tissue we were talking about is much darker in color than the healthy tissue. And the particular laser that was developed for this protocol will just take away that darker tissue. So we take it around the tooth, and that diseased tissue is removed, but it leaves behind the pinker, healthier connective tissue. And that's the key. We need that connective tissue to reattach to the root. Then, with that space that we've created, we can clean the bacteria out, disinfect the area, and then we seal those gums, kind of like tell my patient I'm zip-locking your gums back to the roots. And instead of lowering the gum and exposing all that tooth, we leave the gum where it is and we reconnect the gum to the root with the gum at the level
And the
that it
bad breath
started.
goes away?
The bad breath goes almost immediately, because the bad
Really?
breath comes from the bacteria.
And the bleeding gum?
Absolutely, it's gone. Almost immediately.
And the
because-
teeth get stronger?
Absolutely. The disease process brings in the blood supply. That's where the puffy gums come from. If we get rid of the bacteria, the mouth has all kinds of bacteria, good and bad in it. When the bad bacteria take over, they change the whole environment of the mouth. It's a very hostile environment. If we can remove that bad bacteria, the good bacteria get to take over and remake the mouth. It actually is easier to keep it
So
healthy.
how does it work, by the way? And you brought a video. We're going to go over get to the video in a moment, but how does it work? Okay, so the laser is going, it's killing these bad bugs.
It's killing bacteria. The bacteria that cause periodontal disease are primarily a pigmented bacteria. So again, that dark nature of that bacteria is what the laser attacks. So the laser, just like in the science fiction movies, it comes out of that machine and it destroys those bacteria. Anything that laser shines on underneath there that is dark pigmented, like those bacteria, are going to be destroyed. And
So
that
just
dark
like the way,
tissue-
so in plastic surgery or dermatology, they're doing the same thing.
Exactly.
Where browns and reds are
Exactly.
targeted.
They're
Interesting.
specifically targeted. And in any of those situations, a specific laser is used. And the company that developed this protocol, Millennium Dental, found a laser that just worked wonderfully on that
So
tissue.
not all lasers are the same.
Correct. Not all lasers.
You said
same.
you have the one you have is the only FDA approved
Correct.
laser for this type of treatment.
Correct. It is FDA approved, and the company that developed this will not even give you that laser until you've been trained how to use it. It's the only company, I believe, in the world that will do it. I can't just send them a check and get that laser. I need
And these
to.
are like $100,000 machines, is
Yes,
that right?
so it's a significant investment in the technology, but it's worth it for what it can offer my patients.
Is it? Well, now what do periodontists, the gum disease specialists, say about this laser?
At first, they didn't like it a lot because it just seemed too easy to them. But what's happened over the last 10 years is more and more periodontists are purchasing this laser. They're actually becoming trainers to train the technique, and a growing number of periodontists are adopting this in their practices.
You know, I mentioned, I know somebody that heads up the perio program at Albert Einstein, the University of Pennsylvania, and he says, Randy, and he teaches traditional cutting and stitching, and he said, that's old school compared to
Absolutely.
what this laser can do.
Absolutely.
But he said, but then I talked to another periodonist, knowing you're coming, and they said, Randy, not enough research out there.
Yep.
So what do you say to that? There's not enough research.
There's a lot of research
But
out
you see
there.
it works, you're saying.
Yeah, there's a lot of research out there relative to what's out there for other treatments, which there's not a lot on any of, but it works. It works every time, time in, time out. It's not perfect. We're dealing with the human body. Nothing is just, it's not a magic wand. Treating periodontal disease is difficult. Upper molars.
Would you say it's better than surgery, in your
Absolutely.
opinion?
I like it better for a couple reasons. First, when I'm finished with the procedure, the patients come home and take Motrin and they go to work the next day. When I did the other type of treatment with the scalpel, it was all I could do to get the patient to come back in. So the patients accept it much, much better because it's so much easier. And if I have to go back and retreat a patient. I had a woman, one of my early cases, that she had got a little food up around an area we had done surgery on, and when she came back in, her whole mouth looked great, but this one area was inflamed, and I said, you know, I really feel I need to go in and just retreat that area. And I'm grimacing, because if I told that to my patient with scalpel, I mean, I'd lock the door. She just looked at me, she says, okay, when can we do it? She didn't care. I mean, it was fine with her that we wanted to go and do that procedure again. On just one tooth, it took 15 minutes. It was very effective, it worked. But I was just shocked at the response I got, because I was bracing myself for what I was used to when I told someone, I want to cut your gums again, I want to put more stitches in. No one says, okay, when can we do that? And this lady just looked at me and she goes, fine, that's perfectly fine. I'm okay with you going in and doing that again, because it wasn't that big a deal.
Now, prevention is tough, I guess, to get, especially, nobody likes going to the dentist, right?
Right.
Do you hear that still?
Absolutely.
They say, no offense, doctor?
Exactly.
Do they really say it?
It's not you, I just hate coming in here, yeah. People just have an image of what it's like. And I mean, and I think our practice does well dispelling that myth and showing people this isn't as bad as you think it is.
And people put things off. It's like your taxes or whatever. But you know, and we were talking about this on the phone. That men especially, they wait and they wait and they wait and they wait until it's so much pain or blood or whatever.
Right.
And the nice thing would be to get them early on.
So
somebody watching this, okay, so they're bleeding gums. You
Yep.
say that's a chronic infection under the gum line.
Right away. Bleeding gums is a sign of disease. If you have bone loss along with that, it's a sign of an
So the teeth start to flare or move.
You'll see spaces develop in the front teeth. You'll start to find that, and it sometimes can happen slowly. They don't realize it. You ask them, if you go into any restaurant in town, are there things you won't eat? And they'll go, well, yeah, I quit eating, steak. I don't eat steak as much as I used to because my teeth ache when I do that. And it just shocks me that people are telling me that, but they've just come to see me. That this has been going on in their life, but they haven't gotten treatment.
Do they think it's just part of aging?
Yeah.
I mean, my teeth don't hurt, but if they did, I think I would,
Right.
But there's a lot of people out there with hurting teeth that they have gum disease.
They think it's normal, they don't know any better,
Interesting.
or they're afraid of seeking treatment because they think it's painful. They've had Uncle Joe had his gums cut all up, and he couldn't eat for a month, and that's all they think it is.
Is that cutting the gum, cutting this infection out, common? I mean, is it done routinely?
It's still very routine, yes. It's still
like every day in your town?
Every day.
So let's go to this video. Okay, so
Yeah,
you brought
absolutely.
this video, and what are we about to look at?
Well, what we're going to see is kind of a characterization of the laser going around the tooth, removing that darker diseased tissue. And then we're going to be cleaning the dark stuff on the teeth is the calculus and the plaque that have built up under the gums that's full. It's basically where the bacteria live. And once that's on those teeth, you can't brush and floss it away. We need to get in there and clean that out.
When it's done, do they feel fresh?
Absolutely. We see
breath?
the gums improve immediately. When I see them a week later to do the other side of their mouth, they've got maybe a slight bit of inflammation from the procedure. When I see them at 2 weeks, it is light, pink, firm, healthy tissue. It's amazing how quickly it responds to the procedure.
Okay, we're going to go to the
Great.
clip.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
Interesting.
Yeah.
And so not a lot of dentists, like less than what, 5% of dentists across the country have this?
Oh yeah, probably even less than that. It's a small number right now, but it is growing. I mean, it's starting people are starting to hear that this works, and the patients are following through with treatment. Patients are getting healthier, and so more and more are beginning to get on board with it. But it is definitely where the future is going to be. This is how we're going to be treating it.
I did some research, and with this procedure, there's like this logo says no more cutting or no more stitching.
No cut, no sew.
No cut, no sew.
Yep.
Referring to the traditional method.
Traditional treatment where we had to use a scalpel and peel the gums, and we had to suture everything back together. We don't have to do that.
But like hundreds of thousands of these procedures are being done every single day across the country.
Correct.
And now it's effective.
And it works. Absolutely, it works. There's nothing wrong with that.
But you say there's a better way.
I believe there's a better way. I've been using it for over 7 years now. It's amazing what it can do. I had a woman come in my office. She was a graduate student, but she was 40. So she was a little older than the students that she was going to school with, and a little self-conscious about that. And she knew she had a problem with her mouth. Unfortunately, when she came to me, it was very advanced.
Like what?
Well, she had bleeding in her gums. She was worried about bad breath. She was getting pain when she chewed. She had actually been to another dentist that told her she was going to lose all of her teeth. So she was desperate. She was looking for a solution. She wasn't willing to accept that. So I explained to her that I really felt the upper teeth, the only predictable option for her was to remove the teeth, get into a temporary denture, and eventually get some implants and move into something more permanent that way. And she was not willing to accept a denture for a day, for a minute. She said, I go to school with these young girls. I'm self-conscious. I'm going to be out of school in a year. She said, if you do the laser on my upper, can I keep my teeth at least a year through school? And this was early in me using it, and this was probably the worst case I'd treated.
So you were worried about this?
I was.
Not sure.
I was worried. I wasn't 100% certain because she had teeth that 80% of the bone was gone.
And even you were going to pull these teeth?
On most of her teeth.
And you were going to pull the teeth? Okay.
Absolutely. I wouldn't today, but back then, before I had seen what this could do. So I treated her. I told her, you'll have those teeth for a year.
Meaning you went around,
I went around.
lasered,
I did the Lynette procedure on
the
her
bacteria.
mouth at the top and the bottom. She was in 2 weeks ago. Took an x-ray, checked up on her. She has no pain. She has pink, firm, healthy gums. She chews. She eats every day. That was 6 years ago that I treated her.
The teeth never came out?
Never came out. She has not lost a single tooth since we treated her. And I'm the one that told her she was going to lose those teeth. 6 years later, she's working now. She's out of school. She comes in, and every time she comes in, she looks at me and says, I told you it was going to work.
Interesting. Good for her.
It's almost a little joke between us because she knew I wasn't convinced I could save those teeth.
So gum disease is the number one reason why people lose their teeth?
Absolutely.
Okay.
By a large amount.
And so, based on that story, are you saying that every day people are having extractions when it's possible, that if you went around the mouth, killed this chronic infection,
absolutely,
and the gums get stronger?
Yep. And the teeth tighten up, they get firmer, and they get more stable, and the patients feel better about their mouth. We insist they come in every 3 months. Again, periodontal disease is a lifetime disease. You don't just cure it, you treat it. And they have to come in regularly for routine cleanings, not for laser treatment. They just come in every 3 months and they have their teeth cleaned. And it's usually very straightforward and very easy. And usually, the only people I've had to retreat, and I'll be honest with you, there's a set of patients that have difficulty responding as well as the rest, and those are smokers. People that smoke they still have good results. I tell people the only people I have good results with are my smokers. I have great results with everybody else. Smokers do well, but they don't do as well as the rest. So I really, really encourage patients, if they want to save their teeth, do you want to smoke or do you want to have teeth? If they can quit smoking, they're going to have even more dramatic results.
Now, as you know the Wellness Hour. We interview about a lot of medical doctors on the show, all over the U.S., all over Canada, and they're always trying to explain to me that this infection in the mouth leaks into the bloodstream and causes other problems. And I'm sure that's another talk.
Yep.
But
heart disease, pregnant women have a history of low birth weight babies. It has an effect on the entire body. It's a bacterial infection in the body.
And because there's blood, it's going into the bloodstream.
Absolutely. It's entering the bloodstream every day, constantly.
And this seals it a little bit?
Well, first it removes the majority of the bad bacteria, and it changes the whole mouth to where the healthy bacteria now are in control.
Can you prove it under a microscope?
Absolutely. Absolutely. You can sample those bad bacteria and you can see them afterwards and show now the healthy bacteria are in charge. They've taken over. You're never going to remove the bad bacteria from the mouth, but when you put the healthy bacteria in charge, it's much easier to control it.
Has anybody ever done a comparison with the standard way of cutting this infection out and the laser?
That
as far
is
as measuring the bacteria?
actually, I don't believe it's been published yet, but they have just finished a
What's the word on the
multi-site
street?
study that this is the way to go. That the results are as good or better with the laser, with a significant different patient experience.
Are you ever surprised with the results? Obviously, with the
was.
one gal that you were going to remove all of her teeth.
Absolutely. Well, I'm not as surprised as I used to be. One of the things we need to do when we're doing the laser treatment, because we're asking the body to reconnect and reheal, we don't go in and check those pockets for 9 months. So
When you say pockets, the space around the tooth.
Yeah, we take a measurement from the gum down to the bone. That measurement needs to be a small 2 to 3 millimeter number, maybe 4, for a patient to be able to keep it healthy. When it's a deeper number, they can't get that deep to clean it. So we want those numbers to be small, but we don't check them because the body's
Is
healing.
the future of dentistry, by the way, based on what you're saying, that I guess at lower settings,
Right.
that they'll go in and they'll disinfect the mouth with this laser?
Correct. There are
Is that the
protocols.
future?
Yeah, there are protocols being developed right now. The Lannat procedure for treating bone loss is a doctor procedure. It is a surgical procedure, but there are going to be protocols in place very soon where the hygienists who clean your teeth, anywhere you've got inflammation, anywhere there's that bleeding and disease, are going to be able to use a different setting on that laser and be able to kill that bacteria.
Are you doing that now a little bit in your practice?
We're not doing a lot right now with the hygienists, but that's something I think we'll be moving into very soon.
But like you told me on the phone, that you said, Randy, it's not so much about gum disease, it's about smiling.
Right.
And eating and chewing and fresh breath.
Everybody uses their mouth to do everything every day. That's where you express yourself. That's where your whole personality comes from. And people that with periodontal disease become very self-conscious because of their breath. Their gums start to look funny. They might have stains around their gums, so they're going to hide their mouth. They're going to back away from people because they're concerned about their bad breath. So their personality is going to change. They're going to hide. They're going to bury their personality because they're afraid that they're expressing the wrong thing out of their mouth. And when we can get their mouth healthy again, when we can make their mouth, their tissue look good, the stains are gone, the gums are pink and healthy, they aren't worried about bad breath, their personality comes back. We can give that back to them. We can give them their personality back. They're going to smile bigger. They're going to interact. They're going to be closer. They're going to lean in when they talk to people. They're going to engage again. And that's something that people don't realize when they give that up out of their life, how it affects them and how it affects how they're perceived by other people. And it's nice to be able to give that back to them.
You know, about this, I was talking to a periodontist in Orange County, California. Periodontist, the gum specialist. Mm-hmm. And I said, what do you think about this laser? Because she has one. And she says, you know, gum disease is not a sexy thing to do in your office. She goes, it can get bloody and messy, but this is sexy now.
It is.
Because people are happy. Yep. You're not afraid to call them the next day.
Absolutely.
Their breath improves. They feel better.
Their bleeding goes away almost immediately. They're at work the next day. It's not an experience for them. It's just something they had to go.
Okay, so a recap though, because we are just about out of time. There's two ways to do it. They're both effective.
Correct.
Okay. You can either cut out this bacterial infection, or you can kill it with the laser.
With the laser.
Am I oversimplifying it, by the way? Because to me, it seems...
Not really.
It seems...
Not really.
I mean, I've never heard of such a thing, to cut out a bacterial infection, if that's what it is.
What about putting a laser in your eye and cutting your eye to make you see better?
Okay.
Same thing.
Well, does it do this? You know, I know I have a lot of dermatologists on the show and plastic surgeons, but they're using lasers, non-cutting lasers, and they say it lays down new collagen. It rebuilds tissue.
It stimulates.
Are you getting that in the mouth?
Yeah, the laser actually stimulates the cells to promote new growth. So we're taking that connective tissue that if we were using a scalpel, we were just cutting random. We were cutting out whatever we cut out. Here we're leaving the healthy connective tissue and we're stimulating it to regenerate new connection to the root. We're actually connecting the gum back to the root of the tooth, and that's been shown under a microscope.
That's why the teeth get stronger.
That's why the teeth get stronger. We're healing from the bottom up instead of cutting away from the top. And we've shown that that's been able to be shown on microscope, that is true connection into the root of the tooth.
Okay.
And it's exciting. It's wonderful.
Interesting. Now, people need to know it's a real interview. I'm trying not to side with you here, but if what you're saying is true, it seems like anybody with bleeding gums, bad breath, those kind of things, should look for a dentist that has this FDA-approved laser.
Absolutely. So yes, anybody that has bleeding gums, bad breath, has been told they need gum treatment, come see us. We'll give a free consult, evaluate what their needs are, and I'm sure we're going to be able to help them with that.
And how soon? I mean, how soon? So they're back to eating or whatever. I mean,
Well, as part of the healing process, we have them just take it easy on it for a week. Then they're back to normal function.
so like soft foods.
Soft foods, not because they need to from a comfort. We just want to give the body time to begin to heal. We don't want to be stimulating those areas. So from a comfort standpoint, they're at work the next day and they're fine. We do one side, they chew on the other. We do the other side, they chew on the first side. After 2 weeks, they're back at it. It's easy. It's that easy.
It's now, if 60, I told you, I Googled this, 60 million people have an upper lower denture. In your, and I know you can't prove this, okay, but this is your opinion, knowing what you know. How many of those could you have saved if you'd have started early treatment with a laser? In your opinion.
If we treat periodontal disease early enough, we can save those teeth on almost everybody. But we have to do it early enough. When you've lost 80% of the bone on this patient I talked about, we had a very good result on her, but she was at the extreme end. We need to get you in sooner, and then it's very predictable.
Are there patients that have been told, because I know it's happened in your own hands,
Absolutely.
where they've been told somewhere else, maybe they're scheduled next week to have some teeth removed? Have you ever had people that were scheduled for teeth removed?
And we've saved them. Yes, we have.
All the time, once a month?
We see it all the time. People come in, they don't want to lose their
you see
tooth. Yeah, and we tell them we think we can save those teeth. If you allow us to get in there and treat that, we can save those.
You see it all the time, like every week? I'm trying to pin you down here, but...
Yeah, I mean, every week in my office I see people with periodontal disease they didn't know they had every week, all the time. If we can catch it before it's too late. Unfortunately, I still take teeth out because of periodontal disease, because by the time I get those patients, it is so advanced.
Because you do dental implants too.
Absolutely.
So sometimes the tooth just has to go out.
Right, sometimes you have to lose it, but if we can get you in before it's that bad, we don't have to do an implant. We can save your tooth.
Okay, great. And if they want to learn more about this, they go to your website.
Go to the website, give us a phone call, and we'll bring you in for a consult. There's no charge for the consult. We can explain the process. I can show you the laser and show you how easy it's going to be.
Okay, good. I want to thank you for coming on the show. Very
Thanks
good.
for having me. Enjoyed it
Great
very
information. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can go to our website at wellnesshour.com and put in Dr. Weir. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.